Hi, my name is Dr. Aras Mortazavi, and we're here at Runion Dental Group. I wanted to take some time to explain to you your options for missing teeth, whether you're missing one, a quadrant of teeth, or a full mouth. If you're tired of wearing big metal partial, regular dentures that are just flimsy, or a flipper, a huge appliance to just replace one tooth, there are much better options for you, much better fixed options. And I want to guys kind of show you all the models, all the options, explain the pros and cons of each. We'll start with individual teeth. If you're missing one or two teeth, let's say you're missing this tooth. Now, if the adjacent teeth have old fillings, crack, or decay, one option is to essentially prep those teeth and allow you to heal, and then you would sit over it, what we call a bridge, which replaces that tooth. Obviously, the downside is the adjacent teeth need to be prepped some. However, if the teeth are decayed, once again, that could be a pro where you're hitting two birds with one stone. You would need to clean underneath of this, so we'd recommend getting a water flosser or water pick or using floss threaders to clean and maintain. Alternatively, let's say those teeth are healthy and you don't want to touch them. What we can do is place a dental implant, which is a screw, and wait about 3 to 4 months. It kind of depends on your body and how healthy you are. And then take a digital impression and seat on there what we call an abutment, or it's like a neck connection piece, which then over it goes your tooth, replacing that tooth completely without the need to do anything to the adjacent teeth. Now, if you see a commercial somewhere, if you go out and they say, oh, $500 implant, you do want to be aware that that screw alone is the implant. This piece is called an abutment, and the crown is a separate part. So there's 3 parts to an implant, a dental implant. Make sure that they go over all of that. Also, if there's an extraction, usually the best way to do it is to put some bone in its place to help your body scaffold and filled in, and then a tissue or membrane to allow you to heal. So look out for those as well. We do go over everything comprehensively and package it for you here. So we're not trying to nickel and dime you. We're very upfront about pricing, the procedure length, the quality of work, and what to expect. So you're not caught off guard, because that's one thing that over the past 10 years of practicing, I've seen a lot of patients frustrated. Well, communication wasn't clear. I didn't know. They didn't explain this. We do an excellent job here at Runion Dental Group with explaining everything, so you're aware of what you're getting into. Now, let's say you have a regular denture on the bottom and it's flimsy. There are a couple options. Your best option is getting a couple implants and just fixating it. Alternatively, you could get what we call a snap-on denture, where usually 2 or 3 implants are placed and then your denture snaps in over it. Most people tend not to get this because just with a little bit of more investment, you can get 2 more implants where fixed denture is now given to you, and you don't ever have to worry about taking it out. There's fewer limitations with this. You can eat corn on the cob, apples, steak, whatever you want. You would just see us once a year where we take the appliance out, clean it for you, and put this back on. We do what we call all on X or all on 4 procedures. If you're missing all of your teeth, both top and bottom, can get fixed teeth. Healing time is usually about 3 to 4 months. You will leave immediately with teeth the same day or the next day. However, you have to stay with a soft diet for the healing time of 3-4 months. So if a plastic knife can cut through it, you're okay to eat it. If not, you should wait. That time period is what your body needs for those implants, those screws, to heal and fuse to the bone before we can switch you to your permanent ceramic teeth where you can eat whatever you want. So there's a variety of options, and we offer all the fixed options simply because they're better quality of care. If you want to learn more about your options or get a quote or a consultation, give us a call. We look forward to meeting you and taking excellent care of you.